Okay, so it's a pleasure and an honor to speak after the smartest man in Boston. Okay, so this was published almost exactly 10 years ago, and I think it's just getting better. So now seriously, our lab is studying how to manipulate cellular function in order to generate novel therapeutic approaches to treat mainly leukocytes implicated diseases. And this is a huge field that includes blood cancers, inflammation, viral infection. And everything that you see here in blue is project currently worked in our lab. So the lab is divided into two major groups. Basically, we're also doing drug delivery system, made from naturally occurring biopolymers, and also doing some protein engineering to create better targeting moieties or better kind of a GPS systems. The other side doing more of biology. And of course, the identification of new drug targets will need delivery strategies, or at least this is what we think. So we're trying to combine those two sides in order to create a new personalized medicine approach that will fit to a person-specific diseases. A few years ago, we have published some work, a seminal work that created a strategy to target gut leukocytes and selectively silence a specific gene. And the idea behind this was if we can make those very tiny particles with a specific address, or if we can home them specifically into the gut, this will be phenomenal. And during this process, we also used this strategy to identify a new therapeutic target, cyclin D1. Cyclin D1 is a very known cell cycle regulating molecule, but we have found a new role, and we could never find it without using this nanotechnology. And we found that it's controlling pro-inflammatory proteins during inflammatory bowel diseases such as Crohn's colitis, and it could shift actually the balance between pro and anti-inflammatory, and this is a really important discovery. So using this again, just to show you how the normal gut looks, and this is a normal section, you can see that there are muscles and there are cells and there are immune cells inside this. But if you have a colitis or Crohn, there is infiltration of those leukocytes that come from the circulation and penetrate into the tissue, and therefore destroy the tissue. So if you then use this strategy to silence specific genes, an example, cyclin D1, you can still get a disease, but it's a mild disease. So you can block this intestinal inflammation dramatically. Now, as a proof of concept, if we now are able to launch this small vesicle and target it in the circulation, it's probably also a good imaging capabilities. So we developed this strategy, taking an antibody and put an imaging agent on this, and we have shown the ability to target it directly from the circulation into the gut. And basically, this strategy, we believe that can be combined with diagnostic and therapy, and it's now called theranostics. So the ability to target specific cells and also do imaging and at the same time do therapy, it's called theranostics. And we are strongly believing in leukocyte-directed theranostic, basically taking advantage of the ability of immune cells to home into the right areas. And not only that we are very happy with this strategy, actually Takeda Pharmaceutical, which is the biggest Japanese company, decided to use this antibody, and it's now under a phase 2 clinical trials in few places around the world, one even in Israel, to try and replace the very aggressive colonoscopies that people that suffer from Crohn's colitis has to do. Now, taking this a further step, since we also discover a new therapeutic target, which was cyclin D1, we also wanted to use this for target validation. And together with two companies, and Bob mentioned Alnylam, we have used this also with the same target to go after a cancer target. And mantle cell lymphoma is an incurable malignancy of naive B lymphocytes, and basically has a genetic hallmark. And it's known that this gene, cyclin D1, jumps from its local area into one of the immune system antibodies area, and it's now constitutively expressed. Taking into account the ability of cyclin D1 not only to silence genes and controlling cell cycle, but also to be an anti-inflammatory target, we perform experiments that show that this is a good therapeutic target. Not only that is silencing the genes, but also it's causing the cells to die. Another project that I'm going to briefly tell you about is how we can maybe reprogram hematopoietic stem cells and progenitors during the course of chemotherapy and maybe replacing in the future bone marrow transplantation. This is a very ambitious project. And behind this is the idea that hematopoietic stem cells are super important to generate the entire immune system. Now, what's happened when a person gets chemotherapy? Basically, non-specifically, chemotherapy kills those important immune cells. Therefore, what's going on is that those progenitors or those stem cells are starting to proliferate or starting first to expand themselves and then generate those subtypes of cells. Now, we thought that there's two strategies. One, we can protect those cells, which are very precious cells, during the course of chemotherapy, because they're also wounded cells. And on the other side, we can expand them at the same time. So we actually wanted to use the same platform and just changing now the specific antibodies and going after specific targets that are, majority of them are on the hematopoietic stem and progenitors. And with the help of Irv Weissman and Stanford, we received some very precious monoclonal antibodies or hybridomas that we can use to target those specific cells. Just to show you, and I apologize for these fluorescent images, that if we inject those tiny particles, which are about 100 nanometer in diameter, into the bloodstream, we can then take out the cells, sort them out of the hematopoietic stem cells, and we basically see that we can go after those cells. There are very few of these cells, so the rest are not really stem cells, but other progenitors. So it's a very selective idea, and I want to show you another one, which is more of a microscopy. Basically, if you inject it into naive mice, and you then take control particle that doesn't recognize the target of those cells, and you sort those cells, this is how a hematopoietic stem cells looks. So it's about 5 to 7 micron in diameter, and it looks very nice, actually, very round and very, I would say, yeah, very round. And if you use the targeted system and you go after them, what's going on here is you see your tiny particles are here. And these are sorted. So these are all tiny particles that are exactly between 90 to 110 nanometer in diameter. And you can see those small foots or filopodia. It means the hematopoietic stem cell take them up. This is an in vivo experiment where basically those particles are injected, and then you take out those cells, and you can see how they uptake this. So for us, it's an amazing, basically evident that this imagination or imaginary project can really become very important. Also, and I'm not going to share with you all the kinetics and all the data that we have, but we definitely could expand them in vivo. So we strongly believe that this could be a future for bone marrow transplantation on the one hand, and on the other side, it could also protect them if we silence some important, very dramatic genes during the course of chemotherapy treatment. Very shortly, I'm going to move into one other story. Quite a few years ago, together with Ramona Margalit, who was my PhD advisor, we developed a strategy which is a cluster of particles that can entrap virtually small molecules, larger molecules, and nucleic acid. And based on this, a few years ago, we established a company named Therapeutics with the help of Pontifax and Roche and other, the Israeli scientists office as well, and recently also Arkin Holdings. And the idea behind this is to go after cells that have this high CD44 and to accelerate the specific targeting to cancer cells and cancer stem cells via this CD44 hyaluronic acid interaction. So the core here, the core is cluster of lipids that can entrap basically virtually any drug, and the shell has hyaluronic acid on the surface. It has many advantages. It's a very, very stealth system. The immune system doesn't attack it, not even if you put it in the bone marrow of patient or healthy people. And so this is one of the slides. I just want to show you a few slides that were published in the past, but basically this is a comparison with paclitaxel, a chemotherapy. The amount here, a commercial one, was 20 mg per kilogram body versus our 5 mg per kilogram body. So you can get a very good effect in terms of tumor volumes in a fourfold less increase. And if you go after a commercially available nanoparticle drug called Zabraxen, and you compare it with this targeted system, you get basically a dramatic effect. Also, if you entrap it inside, you entrap doxorubicin, a different tumor, and you go after it versus a head-to-head comparison with Doxil, you get a stunning effect here. Okay, so basically I just want to show you one other example, which is some very aggressive blood cancers, such as acute myeloid leukemia, are prone not to take up particles in general. So we actually wanted to silence a specific gene here, and as a proof of concept, we wanted to utilize those primary cells given us from a hospital nearby. And you can see here that we can nicely silence the gene. You can see here the coating of our particle. These are really cells, primary cells from a patient. And you can see here that we can penetrate into them. The shell is coated with a fluorescent dye. It's green. The drug here is in red. And you can see we can definitely go into those cells, and we can silence genes. And there are control cells that do not silence the genes. And we also strongly believe that this will be part of future therapy. The idea behind this to silence specific genes and also to upregulate other genes. At the end of my talk, I just want to thank the people in my lab, and all the balloons here are people who didn't take their picture, and the funding agencies. And thank you all for listening.
Okay. So the next speaker is Dr. Ina Slutsky, and now we move to the brain side of life, and Ina